Well, welcome everybody. My name is Carly Shortino Poulter. I'm the director of the ARC Advocacy Network at the ARC of Indiana, and I'd like to welcome you to our third installment of our Ask the ARC mini-series on the proposed waiver changes here in Indiana. I know that we've had people join us for all three sessions. Today we're going to review some of the things that we discussed on Thursday, in case you were not able to make it then. But also we've had people continue to submit their questions in the intervening time. And so we've shared those questions with state staff so that they could then address those questions as we go along. We will not be able to take questions live today, but of course you can still submit your questions and we can get those to the state so that we can try to get some people some answers. But I'd like to welcome everybody and thank you for joining us. I'd like to welcome Holly Wimsat, who is the Director of the Bureau of Disability Services. We have Leslie Huckleberry, who's the Director of the Division of Aging, and Andrew Bean, who's the Associate Director of the Division of Aging, who will be talking to us today about the changes that are being proposed for all five of the waivers. And we do have five waivers that either are basically being completely rewritten or are being proposed to be amended. So there is the family support waiver and the community integration and habilitation waiver. Those have both traditionally been under the Bureau of Disability Services, and those have waiver amendments that are being proposed. And then what has up to now been known as the aged and disabled waiver is being broken into two different pieces. Individuals 59 and younger will be moved to what's called the health and wellness waiver, and that will be under the purview of the Bureau of Disability Services. The traumatic brain injury waiver will also be moved to the Bureau of Disability Services. And then for individuals who are currently on the aged and disabled waiver, who are age 15 or who are age 60 and older, they will be moved to the Pathways for Aging waiver, which will be administered by the Office of Medicaid Policy and Planning. And so, ladies and gentlemen, welcome. Thank you so much for joining us today, and thank you for taking the time to talk with people and to answer questions and help people understand what's being proposed, what's really going on, so that it helps address some of that confusion. So I don't know who would like to start.
I'll go ahead and start. Thanks, Carly. Appreciate it. We want to start with just thanking Carly and the ARC for inviting us here to talk with you all today. As Carly mentioned, we also presented last week, and we do appreciate any and all opportunities to engage with our partners at the ARC, but also with the individuals and families that we are here to support. So today, we are here to share some information updates with you regarding the Medicaid forecast and FSSA's home and community-based services. Our agenda, are the slides being shared, Carly?
If you are ready for that, we can.
Yes, I'm sorry. Yeah, I was already diving in.
Yep. Okay. So let me go ahead and start those.
Okay. Perfect. You want to go to the agenda? Next slide, please. Yes, we'll let you know when we need to move slides. Thank you. So this is the information we're going to cover today. We'll talk about the Medicaid forecast update. We'll provide an overview of the waiver transition and also make sure that there's an understanding of what we mean by waiver transition. We will talk about the waiver draft details and the second public comment period, which we are in right now. And then Carly has provided us some questions that we will try to address throughout the presentation. We certainly want to make sure that everyone is aware about those waiver drafts out for public comment and how to give public comment on those. And then we're going to start with the next slide with Leslie Huckleberry, our Director of the Division of Aging, who's joining us today. Leslie?
Thank you, Holly. Good afternoon, everybody, and thank you, Carly, for the introduction earlier. So we wanted to start off by talking a little bit about the Medicaid forecast. And so So as many
Leslie,
of
I'm
you,
going to ask you to hold on just a minute. I don't know if other people are getting this issue, but I'm getting a lot of feedback, making it very difficult to hear. Was anybody else having those problems?
are you still getting feedback?
Not right now.
Okay. I'll keep going, but raise your
Okay.
hand if it comes back again. Okay. So as many of you know, and as noted in our presentation to the State Budget Committee in December of 2023, we identified a potential $900 million variance from our April 2023 Medicaid projections on the costs for the Medicaid program. We have been working hard within FSSA to review our data, our policies, the approved waivers as they're written today, current waiver drafts to better understand the drivers behind that variance. And so we can do what we can to really target and tailor the solutions that we were coming up with to try and address it. So really the goal is to make that as tailored as possible to where we are seeing that variance, focusing overall on the people that we serve across the Medicaid program and across our agency, and continuing that forward momentum on those agency initiatives that currently exist today. Next slide, please. So some of the key drivers of the forecast variance that we did identify include the items on this slide here. So one is the decrease in the federal match that we receive for the Medicaid program. So what this is, the federal government funds a percentage of the Medicaid program, and then we use state dollars to make up that remaining percentage. The federal government, the actual percent that they cover for the Medicaid program is redetermined every 2 years. And so we did experience a decrease in that federal matching percentage. And so while it was a very small percentage increase, the impact on a budget the size of the Medicaid program is fairly significant. So that was one of those drivers that we identified. We did want to note that the change in that federal match is actually a positive for the state overall, because it is an indicator of our improved fiscal position. So it's a little bit of a contradictory thing there, but that is where that came from, and kind of one of those key drivers we had identified. Another item we identified was pharmacy rebates. So those were less than we had anticipated, and so that had an impact on the forecast as well. And then the ABA rates that we implemented, those were implemented later than anticipated. So that was another key driver. And then another primary item that you'll hear us talk a little bit more about is this unanticipated growth in enrollment and utilization with the A&D waiver. Specifically, the growth appears to be related to the rate of utilization of attendant care under the age and disabled waiver in particular. Next slide, please. Thank you. So when we were thinking about how we were going to approach addressing this variance and the $900 million variance that we identified, we really wanted to implement strategies that minimized overall impact to everyone on our programs, and really focus on strategies that actually address the specific drivers of the forecast as much as we could. But coupled with that, we did identify some broader strategies to as much as we can minimize the impact of the projected forecast. So these next couple slides, Holly will talk through those items in more detail next.
Thanks, Leslie. So as Leslie mentioned, we're looking at or have looked at broad strategies to really minimize the impact. And that starts with our home and community-based services enhanced FMAP reallocation. So I want to stress that while strategies have been identified, we do not anticipate that the projected impact of all of these initially identified strategies will fully address the projected shortfall. We're evaluating the home and community-based enhanced FMAP and potential reallocation strategy in terms of how these funds are currently being leveraged by FSSA, and whether these funds can be appropriately used per the terms defining the allowable usages by CMS to contribute in assisting in positively impacting the projected shortfall. The other broad strategy is a pause on the 2% rate indexing. So FSSA, or the Division of Aging and the Division of Disability and Rehabilitative Services, went through a rate review process, and included in that was some discussion around a 2% rate indexing. FSSA has put a pause on that 2% rate indexing approach that was approved by the legislature in the last session and presented to the in the waiver amendments that were most recently put out for public comment in November and December. And we'll talk a little bit more about that rate indexing when I go through the contents of the waiver amendments. We're going to walk through each one of those, and we'll have some additional explanation on those. So when we, next slide, please. So when we looked at strategies to address the drivers, Leslie mentioned the age and disabled waiver. So we are, these are some of the strategies that we're taking with the age and disabled waiver to address the drivers. We are adjusting which service plans on the age and disabled waiver are auto-approved and which service plans will be reviewed by state staff. That is your first bullet there. The review is really going to focus on service teams' appropriate application of person-centered practices and service planning requirements, and those allowable practices. The service plan reviews will assess the appropriate service utilization according to the CMS approved waivers. So that's one strategy that we are will be employing. Then we're also, again, ensuring service definition compliance. So as we review service plans, we'll be looking at, are those services being provided in alignment with the service definition that CMS has approved? Additionally, we are going to look closely at attendant care, home and community assistance, and structured family care, and caregiver coaching and community transition. So those are some of the plans that, or some of the items and plans that will cause a review of the service plans. The state team has been identified to review the service plans and establish processes to ensure uniformity and consistency in the reviews. Our target implementation for that is this month, February. One of the other areas we're targeting involves steps and practices we employ to more fully ensure service definition compliance. We'll be reinforcing practices to ensure all services are approved and delivered in a manner consistent with the federally approved service definitions for those services. Care managers and providers will be trained on home and community assistance requirements. And in the next waiver amendment, currently slated for 2025, FSSA plans to clarify the service definitions for home and community assistance and attendant care. Additionally, our team is developing and will be administering an aligned training across FSSA divisions to ensure requests are reviewed with greater uniformity for specialized medical equipment, home modifications, and vehicle modifications. These are services also available on the CIH waiver and the family support waiver. So we are taking this opportunity to make sure that those, the way we review those things are aligned across divisions. Again, the implementation date for this strategy is set to occur either mid-February or the end of this month. The other key strategy is around structured family caregiving provision for legally responsible individuals, or LRIs. You will hear, I will probably slip and use that acronym, but LRI is legally responsible individuals. The currently approved A&D waiver does not allow for legally responsible individuals to provide attendant care. FSSA is ensuring practices reflect the CMS approved A&D waiver in regard to legally responsible individuals. Now, to define LRIs, That includes parents of minor children and spouses. So when we talk about LRIs, we're talking about parents and spouses providing paid services, in particular attendant care. So we want to create a sustainable path for parents and spouses to support the waiver member. And going forward, that will be through structured family caregiving and not through attendant care. Structured family caregiving takes into account the unique nature of receiving support through a living caregiver. It emphasizes maximizing the member's abilities and independence, as well as supporting the caregiver through training and other support through nursing or caregiver coaching. As a result, the service requirements for structured family caregiving include regular home visits from a caregiver coach and or a nurse and respite care. This is all delivered through a daily reimbursement rate that allows for fluid movement between daily life and care needs. So as a result, the structured family caregiving model of support is really ideally suited to supporting those legally responsible individuals who are being paid to provide care to their loved one. Allowing LRIs to provide structured family caregiving really does or really is in recognition of the important role that protections exist that key family members in caregiving are ensuring or are getting the appropriate support in providing that service. For example, structured family caregiving service requires providers to provide respite to the LRI caregiver. It also requires the service provider to have a backup for the emergency or for the primary caregiver in the event of an emergency, which is really, a key difference with structured family caregiving. So we will be supporting care managers, providers, and members to ensure compliance with the LRI requirements through notification process and through reviewing service plans. So an announcement has been posted that no new LRIs should begin providing attendant care services as of January 17th. We're currently putting system edits in core, or actually those have gone into core to ensure compliance with this. And an IHCP bulletin, specifically BT 202411, was published on January 30th of this year and includes details on what information providers need to submit with provider claims when there is an LRI providing the service. Members who have an LRI providing attendant care now will have several options. Those options are they can transition to structured family caregiving if they want an LRI to continue to support them. They may also choose to have another non-LRI provide the attendant care. LRIs who are spouses of the individual or the member will be able to make the transition to structured family caregiving now. And we're creating a process for parents and children via a waiver amendment. In the interim, parents will be able to continue providing attendant care until SFC by an LRI or structured family caregiving by a legally responsible individual is authorized by CMS. However, families will need support from their care manager and service teams today and going forward to appropriately plan for that transition. So we have been working with or are working with attendant care providers to identify those situations where LRIs are providing attendant care. And we are also working with care managers about how to support individuals and families as they are planning for that transition from attendant care to structured family caregiving. One important note is that even though individuals continue through July, members will continue to have their regular service plan reviews, and plans are eligible for changes as they normally would be. So We have had some questions about if I want to change what services are on my plan. Can I do that? Absolutely. Absolutely. And those plans will be reviewed. But certainly people can make choices or make changes in what services they're receiving as they normally would. So the changes to our draft waivers are reflected in the drafts that are currently out for public comment. Those are out for public comment. And you'll hear, I'll say this several times today. Those are out for public comment until February 16th. So today is the 12th. So just keep in mind, those are out for public comment until the 16th. And then we will be working to implement these strategies over the next 60 days. Next slide, please. So the Bureau of Disability Services, or BEADS, has been engaged in a multi-year waiver redesign initiative for some time. Dates back to 2019, actually. And these efforts have been ongoing as we have continued to take a holistic approach with waiver redesign, knowing that these areas of priority that you see on this slide, improving team dynamics through shared outcomes and communication, enhancing case management and system navigation, and then focusing on key supports to build independence. So these are priorities that were identified by stakeholders, by individuals and families as part of our waiver redesign that's been ongoing, as I mentioned. These will continue to be areas of priority because we believe they are core to the broad enhancement of services and supports for all those BEAD supports today, as well as those that BDDS or BEADS will be supporting post-waiver transition. Now, having said that, we will continue our efforts to connect with individuals and families currently supported through the age and disabled waiver and the traumatic brain injury waiver, because these are not individuals and families that we have had a whole lot of contact with in our waiver redesign effort. So we will continue engagement activities to learn more about individuals and families and their needs and their desired outcomes and how they want to be supported. We really see the waiver transition and as a way to, or really as a unique opportunity for us to align home and community-based services or waiver services across all of FSSA's waiver programs and to identify those common threads that really ring true for everyone with any disability. So we are certainly excited to be working with an additional groups of individuals. And you may have noticed that our name changed some time ago in recognition that we will be post July 1st working with individuals with a variety of skills and a variety of needs. Next slide. So today, what you see on the screen or on this slide is the current FSSA Home and Community-Based Services programs between the Division of Aging and the Division of Disability and Rehabilitative Services, of which the Bureau of Disability Services is a part. Today, the Division of Aging has oversight of non-waiver programs that include Choice, the Older Americans Act programs, the Aging and Disability Resource Center support, and then Adult Protective Services. The Division of Aging also has oversight of the Age and Disabled Waiver. And what you see here is we have split the Age and Disabled Waiver into two different groups by age. And the next slide will help further explain that. But that's really to demonstrate what that will look like, part of what that will look like in the future. So currently on the Age and Disabled Waiver, there are about 28,000 individuals supported that are age 60 and over. On the Age and Disabled Waiver, there's approximately 11,000 individuals that are 59 years of age and younger. And then Division of Aging has oversight of the the traumatic brain injury waiver that serves roughly about 130 enrollees. The Bureau of Disability Services has oversight responsibilities of the Community Integration and Habilitation Waiver, of which there's about 9,000 people being supported, and then the Family Support Waiver that supports about 23,000 individuals. Next slide. In the future, post July or on July 1st, 2024, and moving forward, what you see on this slide is what that will look like in terms of oversight of the home and community-based services waivers. The Division of Aging will continue to have oversight of CHOICE, Older Americans Act programs, the Aging and Disability Resource Support, and Adult Protective Services. The age 60 and over individuals currently served on the Age and Disabled Waiver or served on the Age and Disabled Waiver come July 1st that are 60 and over will move to the Pathways Waiver, which is the Managed Long-Term Services and Supports Waiver. And that is a new waiver, and that will be overseen by the Office of Medicaid Policy and Planning. The Health and Wellness Waiver, and Carly mentioned this is the individuals 59 and under on the Age and Disabled Waiver, about 11,000 individuals. That will transition to the oversight of the Division of Disability and Rehabilitative Services and BEADS. Traumatic Brain Injury Waiver will also be under BEADS oversight, as we will continue to also have responsibility and oversight for the CIH waiver and the Family Support Waiver. I want to reinforce that this slide is reflective of a July 1st, 2024 date. Next slide, please. So currently out for public comment, and I'm going to talk through this quickly because I feel like the time is flying by. The waivers I'm going to talk about and the waiver amendments that are out for public comment were also out for public comment November 8th through December 14th of last year of 2023. So as I walk through those later in this slide deck, I'll provide a high-level overview of those items we shared in the November and December public comment, as well as what is different in the waiver amendments that are currently out for public comment until February 16th. Those waivers that are out for public comment are the Family Support Waiver, and I know Carly talked about this, the CIH waiver, the Traumatic Brain Injury Waiver, the Health and Wellness Waiver, again, that's A&D waiver 59 and under, and then the Pathways 1915 BC waivers that includes individuals on the Age and Disabled Waiver that are 60 and up. Now, there is another waiver amendment that is out for public comment right now that was not out for public comment in November, and that is the Hoosier Care Connect waiver. And we'll talk about that as well. That was not out for public comment in November and December because it was not due to be out for public comment. It came due to go out for public comment in January. So this is, we have added that in just, for awareness that there is an additional waiver amendment out there for public comment. Next slide, please. Okay, so the TBI waiver provides support for people who have experienced a traumatic brain injury. The updates in the January waiver amendment draft include keeping the provider rates the same as the rates as approved by CMS that were effective July 1st. So you may recall, or you may not have an awareness that we were able to implement some significant rate increases effective July 1st of 2023 for our home and community-based services. And those were both those waivers operated and overseen by the Division of Aging, as well as those waivers operated and overseen by the Division of Disability and Rehabilitative Services or the Bureau of Disability Services. The other change in the January waiver amendment draft is that it includes permissive language or permissive authority to implement the rate indexing as the fiscal situation allows. Additionally, in this amendment for the TBI, we have added transfers as an allowable activity under the attendant care definition. We have removed the reference to exclusion for the family ownership of an agency. We have clarified the $15,000 vehicle modification cap is a 10-year cap, not a lifetime cap. And then this draft that's out for public comment now clarifies the policy surrounding the allowance of services provided by legally responsible individuals, or LRIs, to sustainably provide services with appropriate checks and balances. And as we already talked about, it will permit LRIs to provide structured family caregiving, but will not permit LRIs to provide attendant care. Now, some of the items shared during the November-December public comment period for the TBI waiver included the fact that we made some minor language changes in the waiver to align all of the 1915C waivers with matching language. So the 1915C waivers are the FSW, the CIH, the TBI, the A&D, and again, pathways is a 1915BC combo. So where we could create some alignment, there we made those minor changes to language. With the TBI waiver, what we shared in November, December, in that amendment, switched the waiver oversight from Division of Aging to DDRS. And then prior to the amendments we drafted and put out for public comment in November, currently structured family caregiving and home modification assessment were not available, or currently are not available on the TBI waiver. As we were preparing for this waiver transition, we noted that structured family caregiving is available on the A&D waiver, and it's available on the CIH waiver. And in some engagement with individuals and their families with traumatic brain injury, what we heard was that they really needed more residential options. So we took this opportunity to propose adding structured family caregiving to the TBI waiver. To, again, just provide another option to individuals on the TBI waiver. Additionally, home modification assessment, which is a service where a third party, when an individual identifies the need for a environmental or a home modification, a provider that is not the provider that completes the modification goes out and does an assessment and provides the specs for the actual modification. And again, that entity is independent of the entity that does the modification. So that is currently available only on the A&D waiver, and we saw an opportunity to add that service to the TBI waiver and also to the family support and CIH waivers as a means to enhance the quality of modifications currently being made. So we took this opportunity and have proposed adding that to the TBI waiver. And then lastly, we made some minimal changes to service definitions on the TBI waiver, and you'll see this in other waiver amendments to clarify service outcomes, potential ways services could be used, and then to align descriptions across the multiple waivers for consistency reasons. Next slide. The health and wellness waiver, again, the health and wellness will support children and adults age 59 and under who meet nursing facility level of care. The updates in the January waiver draft amendment adjust the transition timeframe for continuity of care for existing service plans to a minimum 90-day period to match timeframes in existing managed care programs. So following the 90-day period, services may not be reduced or terminated in the absence of an up-to-date assessment of the individual's needs that support said reduction or termination. Much like with the TBI waiver, this amendment that is currently out for public comment clarifies the policies surrounding the allowance of services provided by LRIs, and it revises the provisions for the annual rate adjustments to keep the rates the same as what was approved by CMS and effective July 1st of 23, and includes permissive language to implement the rate indexing should the fiscal situation allow that. The health and wellness waiver amendment currently out for public comment keeps the number of waiver slots consistent with previously approved slots. It adds an explanation of potential waitlist procedures. It clarifies language on selection of entrants to the waiver. Next slide, please. It updates cost neutrality information. It revises language regarding when auto assignments occur for those who do not select a Pathways Managed Care entity. That's what we mean by MCE. And this specifically applies to those that are transitioning or will transition from health and wellness to the Pathways waiver at their 60th birthday. As with the TBI waiver, it removes the reference to exclusion for the family ownership of an agency, and it clarifies that $15,000 vehicle mod cap as a 10-year cap and not a lifetime cap. In the items shared for the November-December public comment period, what you see here is very similar to what we talked about with the TBI waiver. Minimal changes to service definitions, to add some additional clarification, minor changes to language to align across all the 1915C waivers. We switched the waiver oversight from Division of Aging to the Division of Disability and Rehabilitative Services, changed the name to the Health and Wellness waiver, and changed the waiver target population to serve individuals age 0 to 59. Again, 60 and above will be served in the Pathways for Aging waivers. Next slide. Okay, so I want to spend a little bit of time talking about the Indiana Pathways for Aging, because again, these are new waivers. This is Indiana's Managed Long-Term Services and Supports waivers. So individuals that will be served by Pathways for Aging include individuals who are 60 and over, who are age, blind, and disabled and qualify for Medicaid services, or individuals, including those age 60 and over, currently enrolled in Hoosier Care Connect. It includes individuals who qualify for both Medicare and Medicaid, or individuals receiving services on the age and disabled waiver or receiving services in a nursing facility. Updates in the January waiver draft amendment or waiver, I'm sorry, that are out for public comment right now through February 16th. Adjust the time frame for continuity of care for existing service plans to a minimum 90-day period to match the timeframes for existing managed care programs. So we talked about this on the health and wellness waiver as well, that following that 90-day period, services may not be reduced or terminated in the absence of an up-to-date assessment of the individual's needs, and that assessment must support the said reduction or termination. Again, it clarifies policies surrounding the allowance of services provided by LRIs. It revises the provisions for the annual rate adjustment to keep provider rates the same as the rates approved by CMS and effective July 1st, and includes that permissive language for us to implement rate indexing should the fiscal situation allow. And again, you will see this particular bullet across all of the waiver amendments that we're talking about today. And then with the updates in the January waiver draft for Pathways, it keeps the number of waiver slots consistent with previously approved slots. Next slide. Additionally, this January waiver draft adds an explanation of potential waitlist procedures and a reserved capacity for individuals aging out of the health and wellness waiver to ensure continuity of care. It clarifies language on selection of entrants to the waiver. It revises language regarding when auto assignments occur for those who do not select a managed care entity. It removes the reference to exclusion for the family ownership of an agency. And as with the other waivers we've discussed, it clarifies the $15,000 vehicle modification cap is a 10-year cap and not a lifetime cap. Things to note that were previously shared in the Pathways drafts is that this waiver, Pathways for Aging, is a 1915 BC combination. So the 1915B waiver authorizes the managed care program, and the 1915C waiver provides the home and community-based services currently available on the age and disabled waiver for individuals age 60 and over. Those receiving hospice services when they become eligible for Pathways, and American Indians and Alaskan Natives can opt in to managed care. Any changes around the service definitions are minimal and do not affect or impact services. All enrollees are eligible to receive care coordination. Enrollees who have nursing facility level of care will also be offered service coordination. Service definitions remain aligned with the current aged and disabled waiver. And I really want to spend just a minute, reinforcing that. We understand and recognize the importance of keeping those service definitions aligned particularly between the health and wellness waiver and the Pathways waiver, knowing that as individuals transition from health and wellness to Pathways, that there is a need to have that be as smooth a transition as possible. And then for more information about the new Pathways program, we encourage everyone to go to in.gov/pathways. There is a lot of great information on that webpage, and it is updated as updates are available as well. So again, we encourage people to take a look at that webpage and visit it frequently. And again, just as in response to some questions we've received about Pathways, the Pathways for Aging will be a Medicaid waiver that is structured to allow managed care entities to manage and coordinate the services and supports. So again, that kind of speaks to the 1915 BC combo that I talked about earlier, but just we had received a question about that, so we wanted to clarify. Next slide, please. The Family Support Waiver Amendment that is currently out. Well, we'll talk through what is currently out for public comment, but the Family Support Waiver, as you know, provides support to children and adults with intellectual and developmental disabilities. The updates in the January waiver draft amendment, again, as with all the waiver amendments and the Pathways waiver, keeps provider rates the same as what CMS approved effective July 1st, and includes permissive language to include or move forward with rate indexing as the fiscal situation allows. Additionally, in this waiver amendment draft, we have added a priority category for individuals on the age and disabled waiver who are subsequently found to not meet nursing facility level of care, but who do meet what is ICFID level of care, or the level of care required to be eligible for the family support waiver. So we wanted to make sure that if an individual is on the age and disabled waiver and loses level of care, or no longer meets that level of care, but they do meet level of care for the family support waiver, that we make that available for them. Additionally, we are clarifying the $15,000 vehicle modification cap as a 10-year cap, not a lifetime cap. We talked about that in the other amendments. We also took this opportunity with the family support waiver to clarify policies surrounding the allowance of services provided by LRIs. And I do want to note there are no proposed changes to how this works today in the family support waiver. It's important to note that there is a 40-hour limit for paid family caregivers on the family support waiver, and legally responsible individuals are not able to provide paid support on the family support waiver. But again, that is not a change from what is currently in the waiver and in practice for the family support waiver. And then this last item in the January waiver amendment draft clarifies previously proposed changes to behavior support services definition. And I'll talk a little bit about that in a minute, but that is a direct result of some public comment that we received in November. So as we're talking about the family support waiver, I want to talk about some of the items that were shared in the November-December public comment period. So we proposed adding a new employment service, career exploration, to the family support waiver and also to the CIH waiver that is really part of our implementation of our employment transformation plan that is really focused around ensuring that all individuals have the opportunity to engage in competitive integrated employment. And there was an additional proposed change in the November-December amendments that included halting entrance to facility-based pre-vocational services for individuals that are transition age, which is 18 to 24. And again, that is part of that broader effort around ensuring individuals have opportunities to engage in competitive integrated employment. I think it's helpful to explain that Indiana has employment first legislation that was originally passed in 2017, and certainly want to give a shout out to ARC, as they were instrumental in helping get that legislation passed. The employment first states that it is the policy of the state to advance competitive integrated employment as the first and preferred option when providing services to individuals with intellectual or developmental disabilities who are of working age, and that is regardless of the nature or severity of the individual's disability. Additionally, our focus on employment and competitive integrated employment for individuals with intellectual and developmental disabilities really comes directly from individuals with lived experience who have shared that they want support to have those opportunities to work in their communities. So our current waiver services on the FSW and CIH really do not support people as well as they should when it comes to engaging in competitive integrated employment or preparing for engagement in competitive integrated employment. So we have committed to looking at our current service array and how we can enhance that, and the career exploration and planning and the changes to facility-based pre-vocational services are really just phase one. We plan to continue to engage with stakeholders on other services and supports that would support individuals in their journey towards competitive integrated employment. And I want to be clear, while we're halting the entrance of individuals who are transition age into facility-based pre-vocational services, the state of Indiana is not closing workshops, but we do have a plan to stop paying for facility-based pre-vocational services in the next several years. So during those next several years, we are going to be, as I mentioned, engaging with individuals with lived experience and their families and advocates about what new services can we offer through our home and community-based services to better support individuals. So we welcome any feedback from anyone on how we can better position individuals and families with regard to employment. Next slide. The CIH waiver amendment, again, the CIH provides support to children and adults with intellectual and developmental disabilities. The January waiver amendment draft keeps provider rates the same. We've talked about that. I won't say that again. One difference on the CIH waiver from the other waivers is that we revised the count of expected participants due to the slide says MFP, that is money follows the person. And then we clarified the cap on the vehicle modification and proposed some additional changes to the behavior support service definition. Again, the items shared during the November-December public comment period, we've already talked about the employment. As with the family support waiver and the TBI waiver, we are proposing adding the home modification assessment service. Now, this was also on the family support waiver, and I didn't go into that, so I want to talk for just a moment. We made changes to the service definitions for the behavior support services and case management services. Those changes were made to clarify the role of those services in supporting people towards competitive integrated employment. But some of the public comment we got during November and December led us to do additional changes to the behavior support services definition, because there was some perception that we were indicating that behavior support services would only be used for individuals seeking competitive integrated employment. And that was not our intent, nor do we think that is the correct path. What our intent was, and it continues to be, is, further defining the role of behavior support services and employment and competitive and integrated employment as one domain or life domain or one area where behavior support services can support individuals and families. And then lastly, during the November-December public comment period, we made some minimal changes to service definitions that we have talked about before. Now, some questions that we did receive from Carly were concerns about, are there changes to who can provide family members that can provide care on the CIH? And this answer is the same as with the FSW. There is no change to that. The rules that are in place today will remain the same. There is a 40-hour limit per paid family caregiver and no provision of services by LRI. We also received some questions about, are there changes to the requirements for eligibility for the CIH waiver? And there are not. There are no proposed changes to that in these waiver draft amendments that were out in November, December, or that are out right now through February 16th. Next slide. The Hoosier Care Connect waiver amendment, as a reminder, who is served through the Hoosier Care Connect, it provides supports to individuals age 59 and under who are blind or disabled and who are also not eligible for Medicare and do not meet nursing facility level of care. So the update in the January waiver amendment draft for Hoosier Care Connect simply changes the waiver target population to serve individuals 59 and under, because again, individuals 60 and up will be served in pathways. Next slide. So the public comment period for all of these waiver amendments and waivers that we've been talking about, that public comment period began January 17th, and it will run through February 16th. So again, 4 more days for public comment. The waiver effective date for all these amendments and the pathways waivers is July 1st of this year. So, again, we will, once the public comment period is over, we'll review those public comments and then submit those waivers to our federal partners with a waiver effective date for their review for a waiver effective date of July 1 implementation. Next slide, please. How to submit a public comment. So it is very important to us to hear from anyone that has public comment on or that has comments on these waivers. The comments on the health and wellness waiver, the TBI waiver, the family support waiver, and the CIH waiver, or those amendments, can be emailed to DDRS waiver notice comment at fssa.in.gov, or they can be mailed in. Now, I'm not going to read the address because these slides, Carly has these slides, and I believe we'll be posting those. We do ask if you mail in public comment, please include what waiver amendment you are providing public comment on. So if you are going to provide public comment solely on the family support waiver, we ask that you note that in what you mail into us. Again, we will accept public comment through email or postal mail. Now, comments on the pathways and Hoosier Care Connect waiver can be emailed to the backhome.indiana@fssa.in.gov email address, or you can mail those again to the address listed. Now, you will note that it is a different address and different email addresses for public comments, but while we ask that you, try to send public comment as outlined on this slide, if it is sent to the wrong email address, we'll make sure it gets to where it needs to be. And again, I want to reinforce that public comment is open through February 16th, which is just 4 days from now. Next slide. So I want to again thank everyone. There are a couple things that I wanted to address that I honestly don't know that I covered thus far. But we did have some questions about structured family caregiving and what that looks like. And just wanted to provide an update that we are working to get some information around structured family caregiving out so that families can have some additional information around the considerations for structured family caregiving. There were also some questions about the assessment that is completed to determine the level for structured family caregiving, particularly as it relates to children. And I just want to note that the assessment we use will ensure that we're looking at pediatric situations and pediatric members or participants in the appropriate way. So again, I think we want to make sure and thank Carly for this invite. That was a lot of information, I know, but we appreciate the opportunity to share some time with you all, and appreciate our partners at ARC in making this possible.
Thank you, Holly. And I know that today was a lot of review of information that was presented on Thursday. We had continued to get some questions after that point, and so we wanted to integrate some of those answers into there, but I know that not all of those questions were answered. You mentioned that you were going to be putting together some more information on structured family caregiving to be able to get that out to people. Some of the other things that have come in even just today were things about especially if structured family caregiving provider agencies are supposed to provide respite. How can families guarantee that those provider agencies will have that, and then also what does that emergency care look like when there's an unanticipated situation and somebody else needs to come in to provide that care. So if that can be addressed during that. But of course, the biggest question that people have, and I know that it's a difficult question, was that, when the initial waiver proposals were submitted and released for public comment in November. Prior to that, the slides from October to kind of introduce this idea, um, specified that legally responsible individuals were going to continue to be paid as caregivers, specifically for attendant care, as well as some other services on the health and wellness and TBI waiver. And I realize that has changed. Can you address why that, what led to that change, and give a little more clarification on that piece?
Yeah, Carly, I would direct individuals and families to the Medicaid Strategies website to talk a little bit about that. And we can look, I appreciate the comments about the structured family caregiving and in some additional areas maybe that we would like that we could potentially cover in that future communication around structured family caregiving. So we can look at addressing those questions as well.
Okay. All right. Ladies and gentlemen, thank you so much for joining us today. I want to thank Holly and Leslie and Andrew for joining us and talking through some of these issues. Again, I know that this doesn't address everybody's questions, and I know that there are still a lot of questions out there. There's still a lot of frustration out there, and I do think that, one of the most important things that we can do is also submit that public comment. Keep talking to officials. Public comment is due this Friday by 4:30. So make sure that you share your thoughts on all of this. I know people have been raising some really good points in not only the Q&A that we've had that has been going on today, but also online and through questions that they've called and asked us. So make sure that you are submitting your public comment. I want to thank everybody for joining us today. This session will be posted relatively soon on our YouTube channel with links through our website. And thank you for joining us, and thank you for taking the time. Have a good day, everyone.